The eye. Parts of the eye: eyebrow, eyelid, iris, eyelashes, pupil. Examination of the eye. Here is an extract from a textbook. Description of to examine the eye. Look for squint, strabismus, drooping of the upper lid, ptosis, or oscillation of the eye. Nystagmus. In lid lag, the upper eyelid moves irregularly instead of smoothly when the patient is asked to look down. Next, examine the pupils and note whether they are equal in size. They are regular in outline, evenly circular. They are abnormally dilated, large, or constricted, small. They react normally to light and accommodation, focus on near objects. To test the reaction to accommodation, ask the patient to look into the distance, hold your finger in front of their nose, and ask to the patient to look at it. The eyes should come together or converge, and the pupils should constrict as the patient looks at the finger. Check also for cataract opacity of the lens. Retinopathy. Hypertensive change in the retina can be classified from grades 1 to 4. Grade 1, silver widen, increase in the light reflex of the arteries only. Grade 2, grade 1 plus arteriovenous nipping, indentation of veins where they are crossed by arteries. Grade 3, grade 2 plus flame shape hemorrhages and cotton wool exudates. Grade 4, grade 3 plus papilloedema, cotton wool exudate. The gastrointestinal system. Here is an extract from a textbook description of how to examine the abdomen. Note if the abdomen is distended by fluid or gas. The presence of fluid can be confirmed by demonstrating shifting dullness. Percuss or tap first with the patient lying supine flat on their back. Then ask the patient to lie on one side and percuss again. In fluid is present the dull note heard on percussion moves. Palpate each region, feeling for tenderness, pain when touched, or masses, palpable enlargement of tissue. tissue. Note also any guardian or rigidity shown by contraction of the abdominal muscles. Guarding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It is a sign of peritonitis. Listen for vowel sounds. Deficits. There are several words for deficits. Doctors sometimes say there was blood in the stools. Have you passed black stools? Patients sometimes say my motions have been very loose lately. Bowel movement is used to refer to defecation. Have your bowels moved today? Have you had a bowel movement today? Bowel habit is a medical expression meaning the pattern of the defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in bowel habit could be constipation, hard, infrequent stools, or diarrhea, frequent soft or liquid stools. Normal stools are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale: hard, formed, semi-formed, soft, loose, liquid, watery. The color can vary from black due to altered blood as in melena to yellow, gray, or even white. Melena stools are often described as tarry like tar, the black sticky substance that is used in road making. The stools may be red when fresh blood is present. Blood that can only be detected by special test is called fecal occult blood (FOB). When there is a high fat content, the stools are pale and are sometimes described as clay-colored. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Gynecology: a female reproductive system. Womb, fallopian tube, salpinx, ovary, neck of womb, cervix, vagina. Menstruation: a period is the common name for menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes LMP 252. Ago means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the form 4/20H, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss. Menorrhagia, often with the passage of clots, coagulated blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In everyday English, it is known as the change of life or simply the change. Symptoms of the menopause include hot flush, sudden sensation of head, and night sweats. A gynecological consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist and patient. Are your periods regular? Yes. How often do you get them? Every 4 weeks. How old were you when start to get them? About 12. When was your last period? A week ago. A week ago. How long do the periods last? Usually 4 or 5 days. Would you say they are light or heavy? Light. Do you get clots? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. What color is it? White. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, IUD, or copper coil. Condoms are available for both men and women.